As promised, I'm going to go over some of the medications that are used that we're going to be discussing. That's for chapter and exam one. I'm sorry. As you can see, we talked about the MAOIs. Some of these are some examples here that we went over in class today. You need to look at the actions, also some of the indication and adverse effects, and looked at some of the nursing consideration. For example, on the first slide, you see the sulfate, sulfate, isocarboxide. These are two examples that we're using. These medicines are used for depression, an big adverse effect of this medication. These medications are going to be hypertensive crisis, and also if the MAOIs are taken or with foods that are high in that contains triamine, you need to look at some of those food examples. Also, I talked about this morning that it caused some weight gain. I'm sorry, on the presentation rather, how they cause weight gain. They also can cause some orthostatic hypotension. And what are some nurse consideration that you would take caution with these drugs? You need to look at that. Also, some SSRIs, some fluoxetine and paroxetine are some of your SSRIs examples. You also need to look at those, some of the indication, also the adverse effects of those medications. As you can see, headaches, dizziness, tremors, GI upset, weight gain again. And again, looking at the nurse consideration, these medicines will be taken in the morning. They need to take it for 4 full weeks. Because if they don't, they won't get the full effect. Then they may also want to stop taking it because of the effects. Monitor for thrombocytopenia, leukopenia, and also anemia. So again, we need to be looking at blood values, lab values rather, for these medications. So you want to take a look at those. Also, you want to look at some tricyclics. I gave an example, amitriptyline. Also, issues for depression as well, and also those clients with sleep apnea. Look at some of the adverse effects of these medications as well. Orthostatic hypertension, you see that again. Also, they may have some urinary retention. And again, the drug indication, nursing indication, again, look at those as well and be able to recognize some of the nursing indication for that classification. And then the next one, you want some urban medication. Um, I gave you two examples that you want to look at, St. John wort and melatonin. Look at some of the indication for that, adverse effects as well. And also you want to look at some nursing consideration. Um, so melatonin, for an example, it can cause sedation, confusion. It's also used for sleep, help with insomnia. Okay, so you want to look at that as well. Also, St. John warts, we talked about it in class. You got to be look at the drug interaction for that medication as well, and some of the nursing consideration for St. John warts. Um, Also, um, methenhyphenate. It's again some of the action of that medication. It's also is used for anti attention deficit and hyper activity. So you want to look at those examples for that, the action, the indication for that medication as well. And I talked about that when I did. It's also in the PowerPoint presentation as well. Also, bipolar, lithium. You need to make sure you look at lithium, the nurse consideration for lithium. Some Again, these clients on lithium, they definitely need to make sure that they do their follow-up appointment because they need to get lab work done. Make sure that the medication is um, looking at the therapeutic um, values of that medication. So there's a therapeutic range for lithium. You definitely need to make sure you be able to teach the clients what to look for, um, and make sure they follow up with their healthcare provider while they're taking that medication. Um, let's see. Also, some antipsychotic medication. There are some drugs that are listed on a high potency, medium potency, and low potency. I gave you an example of one. You need to definitely take a look at those that are high potency, medium, and low potency as well. And some atypical, you definitely need to horn in on risperidone, clozapine, and also olanzapine. Looking at some of the effects of that medication, adverse effects rather. Let's see. I'm just going to go back to just a little bit on those that St. John Watts again. Make sure you notice that you need to avoid the use of it in MAOIs within 2 weeks of each other. Don't They're not to drink alcohol. These St. John Warts is contraindicated during pregnancy. They need to avoid the sun and clients need to be taught to use sunscreen. Again, so make sure you look at that section. Um, and again, back to lithium, I just want to make sure it's on page 7. Uh, like I said, they need to be taught to take the medicine for at least 1 to 2 weeks for therapeutic effects. And then again, we need to monitor for lithium toxicity. And an example of some indication or signs and symptoms of toxicity would be vomiting, diarrhea, dizziness, drowsiness, ataxia, and muscle weaknesses. So definitely you need to make sure you look at lithium. Okay. And then your benzodiazepines, I talked about a lot about that during the lecture also. These are just some examples of benzodiazepines. Look at those medications, that adverse effects, some indications, and also nursing consideration uh, for your benzodiazepine. Uh, Again, with any medication, you want to teach them not to stop the medication abruptly. Again, these benzos have a tendency to be addictive. They not supposed to drink. We're going to make sure we check their renal and hepatic functions while they're taking this medication. And then these benzodiazepines are safer use for those elderly clients. Okay, but we still make sure we have to assess these clients because they can become lethargic and they may fall. So again, we talked about those as well the other day. And then the last classification I want to talk about is the non benzodiazepine. Buspirone, I talked about that a lot. You need to look at the indication for this medication and also some of your, adverse effects and some of your nursing consideration for your non benzodiazepine. And again, let's see. So I've given you a synopsis, and if you have the drug sheet, and if you have any questions about these medications, feel free to reach out to me. Thank you, and I will be uploading this as well.